If you're feeding nursing school lecture slides into ChatGPT and getting back questions that are not preparing you for your nursing exams, you are doing it all wrong. In the next few minutes, I'm going to show you how to take a memorizable fact from your PowerPoint slides and turn it into something that you'll actually be asked on your exam. I'll even explain the test-taking strategy so that you can answer it correctly. If you've already taken nursing pharmacology, here's a line you've probably seen before. Loop diuretics can cause hypokalemia. It's important to know it's one of the complications of that medication. But if you stop at memorization for this important fact and you don't take the time to understand why it happens, then you are only going to be prepared to answer the easy types of questions that are at the remember and understand level of Bloom's taxonomy. Now, if you don't already know what Bloom's taxonomy is, make sure to go back and watch my other video about it, because it is an absolute crime they don't explain this to you in your nursing school orientation. The quick summary is that Bloom's taxonomy is how they measure the difficulty level of your nursing school exam questions. Remember and understand are the easiest types of questions, but on your nursing exams, you're going to be getting analyze and apply, which are much more difficult. That means your nursing exam questions are definitely going to be harder than what ChatGPT is just natively spitting out at you. What does that look like? It looks something like this. A patient receiving furosemide reports muscle weakness and palpitations. Which action should the nurse take first? A, check the patient's serum potassium level. B, administer the prescribed potassium supplement. C, notify the healthcare provider. I think we can all agree that that's never the answer, right? Or D, encourage foods high in potassium. Now, this is where things get really confusing, because all of these things are things a nurse might do in this situation at some point, even call the healthcare provider. And that is exactly the point of these analyze and apply type questions. Because here's what the test writer is really checking. They're checking, can you think through the expected pattern? The fact that the patient's taking a loop diuretic, they're having muscle weakness, they're having palpitations. This could possibly be the signs of hypokalemia. They are also checking to see if you can use that pattern to narrow down what steps the nurse should take next. At this point, you don't know for sure that the cause is low potassium, but you should be suspecting it. And that would be based on your underlying knowledge that furosemide is a potassium-wasting diuretic. Basically, when the medication causes the kidneys to get rid of water, it is also causing the kidneys to get rid of potassium at the same time. And if you've been studying the way that I teach my Study Like a Nurse tutoring members to study, then you'd also recognize that muscle weakness and palpitations are symptoms that might happen when there's not enough potassium in the body because they're messing with the action potentials at the cellular level. So the pattern is recognizable, but we haven't confirmed it yet. It's kind of like playing detective during your study time, which makes learning fun again. It also makes the priority nursing action in this particular case an assessment, a nursing action that would provide the information we need to be able to either confirm or deny that the patient does in fact have hypokalemia. And that is why the best answer is A, check the serum potassium level. Once you've confirmed that it is low, then you'd move on to interventions like administering potassium, encouraging high potassium foods, and yes, even notifying the healthcare provider. But if your study time stopped at memorizing furosemide causes hypokalemia, well, then you're always going to be stuck feeling a little bit fuzzy, probably narrowing it down to 2 answer choices and then second-guessing yourself and picking the wrong one. That's why you can feel like you know the content after lecture. You can understand and regurgitate every slide and still get the question wrong on the test because you are stuck studying at the understand and remember levels, but you're being tested at the analyze and apply levels. Once you start recognizing what difficulty level your questions are at, you'll know exactly how to think through it and which answers to prioritize. If you want help practicing that kind of nursing reasoning, that's exactly what we do inside the Study Like a Nurse tutoring membership. I even built and trained specialized AI tutors that quiz you at the correct level of Bloom's taxonomy, the analyze and apply level. So you can practice thinking like a nurse and not just memorizing like a student. Comment below with info, I-N-F-O, and I'll send you the details on how to join. Or if you're not ready to join and you just want a better way to study that prepares you to answer these more difficult nursing school exam questions, comment with SBSS and I will send you a free overview of my Silver Bullet study system to get you started.